60 to 90% of high school, collegiate, and international combat sports competitors have used rapid weight loss strategies before. I would say the same goes for powerlifting and weightlifting competitors. Gender is not associated with prevalence of rapid weight loss. Higher competitive levels can lead to more aggressive strategies in some but not all sports. However, youth athletes should understand that weight cycling can negatively impact their growth and development and put them at a higher risk of weight loss related problems later on. Most athletes lose 2 to 5% body weight, but a considerably high percentage will lose around 5 to 10%. Many have even reported large losses greater than 10% of their body weight. Keep in mind these reductions are accomplished in only a few days before competition. To lose this amount of weight in such little time, some extreme weight loss measures can be taken. Methods are used like reduced liquid intake, use of saunas, sauna suits, reducing food intake, and fasting completely the day before competition. More extreme methods are necessary for larger weight losses, like vomiting, diet pills, laxatives, and diuretics, banned by the World Anti-Doping Agency. Rapid weight loss can have psychological effects which can harm performances. It has shown to decrease short-term memory, stamina, concentration, self-esteem, and increase confusion, rage, fatigue, depression, and isolation. A major concern is the amount of athletes with an uncontrolled appetite while eating and how much that number rises after competition. This issue of feeling no control while eating shows a classic symptom of an eating disorder. Most athletes in tournament present a better competitive result in the lower weight classes, which is the reason for the desired weight cut regardless of health concerns. Strength levels can be negatively affected by weight cycling throughout a season, but do not seem to be affected by rapid weight loss prior to competition. Most issues with any sort of anaerobic performance are often a result of not being able to refuel and rehydrate after the weigh-ins. Athletes with no experience in cutting weight seem to be more affected by the rapid weight loss. Also, a 5% weight loss has been shown to increase the rate of injuries during competition, some being blacking out and concussions in contact sports, but extreme cases can even lead to death. Some precautions an athlete who needs to reduce more than 5% should consider not cutting weight, or at least not do so rapidly. If the athlete will not have adequate time after weigh-ins to rehydrate, then rapid weight loss strategies should be avoided. During recovery, athletes are encouraged to consume high amounts of fluids, electrolytes, carbohydrates, and creatine. It may take 24 to 72 hours to completely rehydrate, and the brain is often the last part of the body to rehydrate fully. To rehydrate, a good strategy is to consume 1.5 liters of fluid per 1 kilogram or 2.2 pounds of body weight loss. This fluid can also have a solution containing 0.5 to 0.7 grams of sodium per 8 ounces of water. Another good drink is Pedialyte, which has a large amount of electrolytes as well as some sugars to help rehydrate quickly. In some cases, fluid buildup can occur, causing swelling in joints, such as the hands, also known as edema. In some extreme cases, oral rehydration will not work. This is where intravenous rehydration may come into play. Oftentimes, athletes making cuts over 10 pounds will consider using this approach to rehydrate. It is important to understand injecting straight water can be dangerous. A sterile water injection can cause hemolytic reactions leading to renal failure and death. Additives are necessary to normal tonicity, such as electrolytes and dextrose. Typically, this is also known as a saline solution. Too rapid increases of hypernatremia can lead to cerebral edema, seizures, and also possibly death.